lot of traffic that night, and I was just calm as could be.
Good. Now, you were telling me something that I never thought about, and that was about reading.
I was, the night I got the appliance in, I was actually able to read for about an hour, where I could actually understand what I was reading and not have to start back over numerous of times and just eventually get aggravated with it and just put it down. So I'm able to actually enjoy reading and not just have to hear everything on TVs. And that's a big change, because I never used to read because I didn't enjoy it. There was no way for me to learn anything from it. So.
Okay. And what about your friends? What did they say?
It was hard for friends. Family understood a lot better because they've seen the videos and stuff. But with friends, it was the day after I got back was pretty much a day of demonstration to let everybody know how it worked. And I had a lot of people that was just denying that this little device could help so much. But then it was basically a demonstration day. I had to take a whole day and show everybody, so they eventually came to realize that it was there to stay. So.
And how about you had those severe sweat?
Yeah, had a lot of sweating. When I get into quiet places, it makes me nervous, so I try to suppress it a little more. Eventually it would just make me sweat, and eventually it just make it worse and have to come out anyways.
And
now there's no sweating, got dry clothes, ain't got to worry about finding a place to dry off.
What's your favorite shot?
So it's helped out a lot too. And with the loud vocals, sometimes I would be hoarse a lot because of yelling out. I had a lot of neck pains, back pains, and they're gone. I'm actually able to sleep for 15 minutes, go to sleep within 15 minutes compared to an hour and a half, which sometimes more. Just depends on how stressful that day was. But now it seems like I could have all the stress in the world and I'll still get to sleep within 15 minutes. So,
even better.
Yes, it's amazing.
And your dad was saying he doesn't have to wear hearing aids anymore.
Yeah, I'm actually, with being quieter, his hearings came back, so that saves some money. Have to get some hearing aids before too long if we didn't get this corrected, so it's helped out with that.
And last one, how did Mom do?
At first, Mom was still, didn't want to believe it. It took about a day to her to finally realize that it was gone. At first, I think it was more of a shock to her than just not believing. And it took about a day or so to set in, to realize that it was actually gone.
After 14 years, it only took one
thing to cure it, and it's still, after 12 days, it's still hard to believe that I don't make any sound, or I'm able to get out to go places, not have people staring at me. So it's a blessing.
Good thing. All right.
This is a patient 1 month after delivery of the appliance. He has returned. The appliance had worn down a little bit, and some of his symptoms had started to creep back. But he'll describe in his own words now the improvement he has experienced in the past 30 days. So why don't you tell him what's happened that you've experienced?
Well, in the past 30 days, I've had all of my symptoms gone. I felt my jaw actually shift forward, my lower jaw shift forward, and that's when I noticed the symptoms started coming back a little bit. But I figured I'd have to get it built back up. But now, since I've got it adjusted it. I don't have any feeling whatsoever.
And you've been offered a job in law enforcement?
Yes, I've been offered a job. I got to go Wednesday for a training for a law enforcement job, and hopefully that'll go well. I've never really got to experience any kind of job working with the public, so it'll be a lot different.
Okay. Tell us about people that knew you before, you know, the experience other people, friends, neighbors, etc. have had.
All my friends now have pretty much gotten used to not hearing me. Sometimes it'll be a little awkward for them because they're so used to it. But other than that, I've still got people that I haven't talked to in a while that will call me up. I had actually a phone call last night where a guy called me and was wanting to know how it was going because he heard about it.
Okay, well that's good. Okay, give me some blue.
What I am going to do now is adjust the appliance 3 or 4 times using articulating paper to make sure it strikes equally on both the left and the right sides with simultaneously in time and with pressure. Notice, however, when I remove the appliance from the patient's mouth, the symptoms do not return as they did when I adjusted it on the delivery appointment. The symptoms, the vocal tics, the head movements are gone and they stay gone while the appliance is out of the mouth. This symptom-free interval increased while the patient was wearing it and as his nervous system adapted to the appliance.
Does that feel even now?
Yeah.
That's the total adjustment we're going to do. It doesn't get any quicker or easier than this. The clinical information pertinent to this patient is that his MR imaging showed bilateral TMJ disc displacements with reduction. He has a class 1 dental occlusion. He has a maximum interincisal opening of 46 millimeters with lateral excursions of 10 millimeters. These excursive movements as well as his interincisal movements to me are impairments, less than normal. If you think they are normal, plus you see this class 1 dental occlusion, you may think this is a normal patient. To me, he is not normal at all. He has full body lateral contractions. His eyes are sensitive to light. He has bilateral blepharospasms, which mean he blinks constantly. He's chemically sensitive. He has uncontrollable face movements. In between these uncontrollable face movements, he has lack of normal function of the muscles on the right side of his face. When palpating his head and neck, I elicit pain from 32 different anatomical areas. This young gentleman returns after 14 months of wearing his appliance. It's a little bit worn down and his symptoms have started to creep back, and we're going to resurface it and rebuild it today. He comes from Vancouver, Canada, which is a couple thousand miles away, so he doesn't have the opportunity to run in here every week or month like a lot of our patients do.
Yeah, it's been about a year symptom-free, but I guess as my appliance has been worn down over the last 2 months or so, my symptoms have been coming back. So I've come back for resurfacing, and I'm sure that'll make everything right again.
Okay. And you went to someone else, you said?
I did go to see another doctor who promised results, and at twice the price made things worse for me. So he had given me another style of appliance, said the one that I had now would be insufficient, and the one I went to see him because he's in my local vicinity, and after seeing him and having the appliance made, he actually made things worse. Symptoms are actually worse than without the appliance, and so I've come back to see Dr. Stack, who I know can get things fixed for me properly.
We have added acrylic to the occlusal surfaces of this appliance using the swallowing technique, and we are making a flat appliance so that we are now in the process in the laboratory where we are going to remove the excess acrylic with this lathe. And we do that by beginning to trim the occlusal acrylic by holding the appliance against the face of the wheel to eliminate the impressions of the maxillary teeth in the hardened acrylic. We flatten this down until the indentations of the maxillary teeth are just about ready to disappear. And then we go to narrow this occlusal surface leaving just about 3 millimeters of acrylic on either side. On either side of this center line where the upper teeth occlude. This is what the appliance may look like after a very quick and rough trim. Then we go to the other side and repeat this process. Essentially, we are trimming the appliance down to where the lingual cusp of the upper teeth just disappear. We continue to trim this surface until these black pencil marks just about disappear. And this is the end of our rough trimming process. Next, we take a drill and smooth this down. We scallop around the clasp. Next, we fill in any rough spots or holes with a little acrylic powder and liquid. To form a smooth surface where the tongue is going to be. Tapping it to spread the powder and liquid. And then we put it in our pressure pot. put the air pressure into 23 pounds for 90 seconds. Just come from the laboratory where we have ground down the occlusal surface of this appliance so it's flattened, which is going to allow his mandible to move around forward, backward, left, and right, and position this in whatever position his body wants it, rather than dictating some arbitrary position. We're going to put it in. Yeah, good. And adjust the occlusion, tap tap, by having him right up and down on this thick articulating paper. And see how close this is without any adjustments already. Now we balance the occlusion using the articulating paper. As a final step, we coat the inside where the tongue is going to rub against with this pressure indicating paste called PIP. And we place it back in the mouth. Okay, close down. And we have him say the following words. Say Mississippi.
Mississippi.
66.
66.
Churches.
Churches.
Ohio.
Ohio.
Count from 60 to 70. Quickly.
61, 62, 63, 64, 65, 66, 67, 68, 69, 70.
Okay. These words contain all the sibilant sounds in the English language. So we'll take it out and see if his tongue has been hitting unduly against the sides here, and are going to cause a potential sore spot. And see, there's one possible place right there, and so we will just relieve that, and then he will be good to go. Solving our problems ahead of time. We'll give this appliance one final polish and send this young man back to Vancouver. We have just finished polishing this appliance now, and we're going to insert it to the patient. And wait. Is it hidden evenly?
Yeah, that's good.
Spot on?
Yeah.
Spot on, okay.
Bang on.
Okay. This is the end of this appointment, and this is all it takes if you happen to know what you're doing.